today. It is a pleasure to do this again. Looking at how we started our very first series, I think that was in 2020 during the pandemics, and how we have continuously kept up the pace with what we are best known for, awareness. Today's presentation will be on closing the care gap, uniting our voices and taking actions. And this is a very relevant topic, I must say, and it's same as the theme for the World Cancer Day 2023 as part of an ongoing 3-year campaign. So we've lined up quite some interesting speakers. They are here and they're going to be looking at this topic from different angles and different perspectives. And you're very much free to drop your questions, your comments, all in the chat box. If you want to get more information about Lakeshore Cancer Center, what we do, our services, you can very well reach out to our Head of Strategy and Development, Dr. Oge Ilegbune, or alternatively, out to the marketing team. I'll be dropping out our contact details in the chat box very soon. Just some very few Zoom etiquettes. We will be expecting everyone to mute if you are not presenting, especially as soon as you enter into the meeting, you're expected to mute yourself. And if you do want to speak, you can just signify by raising up your hands and someone will definitely attend to your questions. You can keep your videos off if you wish. More importantly, we encourage everyone to participate in the poll session, and that will be coming up during or towards the end of the presentation. Okay, so without wasting any further time, I'm very eager to introduce our very first speaker. And I think it's Dr. Oge Ilegbune. And she's going to be spending 5 minutes on her presentation, or maybe less. And she's going to be talking about the 2000 Charter of Paris against cancer, the when, why, and how. Just to brief you, give you a little background or bio of Dr. Oge. Dr. Oge is a graduate from the University of Nigeria Medical School in Enugu, completing her housemanship and national youth service. She left the shores of Nigeria for the United Kingdom, where she went on to complete her residency in general practice, becoming a qualified general practitioner and an associate member of the Royal College of General Practitioners of the UK. She worked as a general practitioner for 8 years in the primary care before returning to Nigeria in 2014. Dr. Oge has immense passion and enthusiasm in her advocacy. This is the head of Strategy, Development, Outreach, Lakeshore Cancer Center. Dr. Oge, you are very much welcome to this webinar, and we are very much indeed excited to see what your presentation will be all about. Over to you. Thank you very much.
Okay, thank you very much. Can you all hear me?
Yes, we can.
Okay, thank you, and good afternoon to everyone. It's a real pleasure to be here today, talking about World Cancer Day. Effectively, that is what we're trying to do, to raise awareness of World Cancer Day. And I'm excited about what my own topic is really, because I don't think many people are actually aware of the background of World Cancer Day. How did we actually get to February 4th every year? And it was very interesting also doing a little bit of research around it. So 2000 Charter of Paris against cancer. Just a second. Let's see. Okay, so the question is the when. When did this start? What, how did it all start? And World Cancer Day actually originated in 2000 at the First World Summit Against Cancer, which was held in Paris. Also described as World Summit Against Cancer for the New Millennium, Charter of Paris, 4th February 2000. And we all remember the whole excitement around the millennium, going into the 2000s. And there were just so many ideas, so many innovations, and this was one of it. So, and the why. So many people came for this summit, leaders of government agencies, cancer organizations. It was a global summit. And they produced a document that actually had 10 articles outlining what was described as a global commitment to improving the quality of life of cancer patients, and also a commitment to the continued investment and advancement of cancer research, prevention, and treatment. And, there's always been a bit of a narrative around cancer and, the future of care. But this was actually the first time there was this sort of a deliberation and agreement that the quality of life of cancer patients was paramount, was priority. And there was also priority around continued investment and advancement of research, prevention, and treatment. So we're looking at the year 2000. And then the how. So there were 10 articles, like I mentioned. There was article 1, 2, 3, 4, all the way to 10. And each of these articles actually dealt with a different aspect of this whole commitment from different views. But the one that relates to this World Cancer Day, what we're talking about today, was in Article 10. So there's a lot of words, and I would say to people, please go online and actually look at all the different articles, especially if you're interested in knowing more. I'm not going to read everything on this slide, but the main thing, number one, was recognizing the declaration by all appropriate institutions that February 4th shall be marked as World Cancer Day, so that each year the Charter of Paris will be in the hearts and minds of people around the world. I personally found this very emotional, and profound when I was going through, because this was a declaration, this was a promise. And actually, since 2000, we have continued to try to fulfill this promise. So again, a few things about the article: forming a global network of advocacy groups to encourage grassroots support for charter articles within their communities. There was also creating a global research organization made up of professional societies around the world. Those in the cancer space can recognize a lot of this. There's been quite a lot that's been achieved, but there's still a lot more that needs to be achieved. And so 23 years later, here we are, 2023, and we do have an organization, the UICC, the International Union Against Cancer, an organization dedicated to increasing global cancer awareness, coordinating World Cancer Day, and supported by WHO and other international organizations. And even though on February 4th and the week before and the week after, and really the whole of February, people come together, the UICC is actually functioning throughout the year, every day, 24/7, striving to raise cancer awareness, forming partnerships, and promoting educational activities. And so me here today, you, the audience, whether you're in the cancer space or not, and others, we're actually a continuum. We are part of this journey. And in honor of World Cancer Day, many health institutions and cancer centers have various information, a bit like what we're doing today, the webinar. In some places, there's a walk. Some of our colleagues here in Nigeria have lots of work. We have a lot of activities going on in Nigeria and in different parts of the world, a gala, a concert, auction, whatever you think, you can contribute. And in addition, we also have televised programs, whether it's a radio show, whether it's a TV, this is a continuum. We are continuing the journey. And so the whole idea of this part of the introduction really is to inform people how we went from there to now and how we wish to continue from now to the future. Thank you.
Thank you very much, Dr. Oge. Very concise, straight to the point, and it carries a lot of information. I, for one, I was very eager to know what this was all about, and it really feels excited to get to have more ideas about the articles and every other thing you've pointed out in your presentation. All right, our next speaker, she's going to be talking about Closing the Care Gap 2022. I'll just give you a little bio. Tolutokpe Adiola, you can share your screen while I run through your bio. She's a public health professional with keen interest in community development. She started her career as a volunteer and transitioned into programs coordination in the area of healthcare within the not-profit sector. She has over 7 years experience in programs management in maternal and child health, sexual reproductive health, and cancer care. She currently serves as the program coordinator at the Foundation for Cancer Care, where she is involved in the coordination of cancer sensitization, screening, and treatment programs. She holds a master's degree in public health from the University of Lagos. Mrs. Tolulokpe Adeola, you are very much welcome. And it's time for you to give us your presentation, at least 10, before 10 minutes. It's going to be 10 minutes max. Give us a presentation and tell us what you have. Thank you very much.
Okay, thank you very much, Otis, for the introduction. Good evening, everyone. I'm glad to be here. Thank you for the opportunity and for having me. So I'm speaking on closing the care gap, uniting our voices and taking action. Basically, that's the theme for this year's World Cancer Day. And, it's beautiful that the particular theme, Close the Care Gap, started last year. And it was about, realizing the problems, in cancer care, identifying the gaps, the inequities, that are available in terms of cancer care costs, the barriers to care, discriminations that people face in terms of like accessing care. And now, it's about uniting to take action, collaborating to take action. And it's beautiful because the truth is that there is something every one of us can do, and the power of collaboration cannot be overemphasized. So I would just start off with a brief introduction of what we do at the Foundation for Cancer Care, to also close the care gap. So Foundation for Cancer Care is actually a non-profit space. We're affiliated with Lakeshore Cancer Center. And basically, our vision is to foster collaborative cancer control and prevention. So we're very big on collaborative activities because we found that with partnerships, you can actually do more. And our mission is to promote comprehensive cancer care in Nigeria, focusing on prevention, on treatment, and regional cancer control. We became fully operational in 2021, even though the foundation has been in existence since 2008. And Lakeshore is actually one of the offshoots of the foundation. So basically, we aim to provide free education, screening, and treatment to people from underserved communities and provide capacity building to health workers as well. So I will talk about a few of the things that we've done since 2021, October. We've been able to fund 8 patients who were in active treatment. We were able to fund their radiotherapy treatments. Over 2,500 people have received our educational flyers. And we have also reached out to young people, students, through our Crush Cancer Early campaign. And also, we've been able to screen over 700 women, for breast and cervical cancer. And over 400 of this is actually the mammogram for women. So these are some of the activities that we have been carrying out, in order to close the care gap. So, the theme of this year's World Cancer Day is very specific. It's about uniting our voices and taking action. So it's actually time for us to take action. And I know that, a lot of organizations, have been doing so much, which is beautiful. But, just to help us see how much more we can do, regardless of, who we are, whether we're individuals, whether we're health workers, whether we're part of organizations, there's always something, that we can do in our own little way and in our own little niche. So first of all, I'll be talking about education and awareness. So, this is one of the most important, aspect, because when you have information, you can actually take informed action. So, and this is one of the things that we do at the foundation. So I have a photo here of some members of our team in a marketplace, actually talking to women about cancer prevention and also trying to encourage them to take up screening. So this is really a low-hanging fruit that everybody can actually participate. So whether you're an individual, within your office space, within your school, even at home, this is something that we can all do. You have access to information and you're telling the next person about, how to prevent cancer. What are some of the lifestyle changes or the lifestyle choices that you should, opt for to ensure that you live a healthier life. It can be about telling people how to have access to screening, referring them to a facility that you're sure that it's a credible facility for screening, just little things that we can do in our own little way. Even if you're a health worker, just patients that you come in contact with, talking to them about how to access care and giving them information about cancer. That's one of the ways through which we can actually close the care gap. Last year, during the World Cancer Day celebration, the foundation, in collaboration with other organizations, were able to have a cancer awareness walk. And, we went around Ikeja and we're distributing some of our educational flyers. Even those simple information pamphlets went a long way in informing people about what they needed to know about cancer. We got a lot of people calling to ask further questions. How can they access screening? So just little things like that can also help us in closing the care gap. So, I'll move on to partnerships and collaboration. And, like I said, this is a very, very critical part because you can do so much more when you work with other people, when we unite. So this is part of like uniting our voices. And I'll just give an example. So last year we had a mammogram drive for over 400 women around Lagos. But, when there's partnership and collaboration, you may have some resources and there are some that you don't have, but another organization has access to these resources. When you come together, you are able to achieve, a great result in line with both of your visions and goals. So for example, we partnered with Lakeshore Cancer Center, who has the manpower. We partnered with Lily Health, who has a mobile mammogram, because we wanted to go into the markets. So we don't have a mobile mammogram, but we're able to work with Lily Women's Health and take the mammogram to the marketplaces. And then, our funding partners who actually funded it gave us the finances to do it, and we went ahead to implement. So that's an example of how partnership and collaboration helps us to actually close the care gap by taking action. So I'll move on to the next point. Support for cancer survivors. So this is also, one of the ways through which we can actually take action to close the care gap. And it can be as simple as just paying transportation for a cancer survivor to go for their treatment, So just simple actions, or even accompanying them to the hospital, spending quality time with them. This is a very, very critical way to, provide support to cancer survivors. Interestingly, today I was having a discussion with one of the beneficiaries of the foundation, and she was telling me how one of the things that helped her get through, the treatment phase for her was the stories of other survivors, the support she got from their words, from how their own testimonials. So, that way she was able to get support and she was able to pull through that period of a trying time, of her treatment. So we can't overemphasize, the value of support for cancer survivors. And we also have programs that help us, provide physical support to our survivors, psychological support. Like, the photo that you can see here was last year during the Cancer Survivors Month, where we organized the paint and sip for them, just to help them unwind and enjoy themselves, be amongst each other, listen to each other's stories and be inspired. So, that's one of the ways. And then patient navigation. So I guess this is really for health workers, because, and basically frontline health workers who come in contact with people within the communities, and people access frontline care. So you may come in contact with patients, with different symptoms, and, being able to help them navigate care, to go to the right places to access their care is very, very important. Because, one of the issues we have with late cancer detection is misdiagnosis, or the wrong kind of treatment. But if we're able to help patients navigate care appropriately, they are able to get the right kind of care, quality care on time, and they have better outcomes. So, health workers are also very, very they are saddled with the task to ensure that they are helping patients navigate care appropriately. And I'll just give an example. Last year, there was a case of a woman who went to a hospital, and because she found lumps on her breast, and then the doctor that she met with did a physical exam and just told her that, oh, you have lumps and you would have to cut off your breasts, without recommending any tests, without just by a physical examination, which is not the appropriate thing to do. So at the end of the day, long and short, we tried to help the woman do the right thing, but she went back and got her breast cut off because of the first contact that she came, that she had with a medical personnel. So it's important that we have the right information about places where people can actually access quality care, and be responsible enough to refer them as appropriate. So volunteering. So this is also a very effective avenue to contribute to closing the care gap. And, it's a low-hanging fruit. Everybody can be a volunteer, regardless of age. We have someone who just completed secondary school who volunteers with us, on some of our programs. We can even have like secondary school students. So it's not age dependent. Even older people can also find ways to volunteer and be part of courses that promote cancer care. So, contributing your time, contributing your skills, contributing your knowledge, your ideas, these are some of the ways that we can actually contribute to closing the care gap. And research. So this is also very, very important, because research actually helps to identify gaps in terms of, okay, what are the gaps in the cancer care space, and what are some of the programs, the initiatives, the innovations, that can be used to fill these gaps. So research actually plays a very critical role in helping to close the care gap. We can identify inequities to access, identify barriers, and try to cover up for these areas. I mean, new drugs, safer and more effective treatments are being discovered every day, as a result of research. So this can actually not be overemphasized. And I mean, every one of us, if you're a BSc holder and you're writing your final year project and you're doing research on cancer, you're actually contributing. If you're a master's holder, you're contributing. If you're doing research in the area of cancer care. So, that's one of the ways. And through these innovations, new initiatives that actually help to close the care gaps are discovered, and they can be implemented. So, so in closing, I would say donate. So this is also, one of the ways through which we can close the care gap. I mean, it doesn't matter how small or how large it is. Whatever you give, especially when you're giving to a credible organization, will definitely go a long way in making a difference. So if you have 1,000 naira, somebody else gives 500,000 naira, I mean, it's donation. There's no disparity or differentiation. It comes together to do a lot. So I would say that we should also look into this, like donating helps to close the care gap. And it doesn't even necessarily have to be finances. I mean, there are people who have sponsored it could be maybe sponsoring drinks for a particular event. It could be giving out maybe a venue. So there are several ways through which we can contribute, right? So I think that in closing, I would say that there is no action that is too small. So there is nothing that is too small. No matter how small the action is, you are making a difference. And definitely every single person can contribute in one way or the other to help to close the cancer care gap. So this year, let's unite our voices and let's take action. Thank you.
Thank you very much to Lulokbe. Such a wonderful presentation. You've carefully taken out time to outline all the various ways that we can actually close the care gap. So I think this is actually not, it's actually more than lip service. It's more of implementing these actions, from education and awareness to collaboration and partnership. Every single bit is very important in closing the care gap. So I think these are like an open question to everyone. How well are you actually implementing actions to close the care gap? I just want to remind everyone that if you know that you are not speaking or presenting, please remember to mute yourself so you don't disrupt the speaker. All right, away, we're going to go to the third speaker for today. So nice to have a cancer survivor in the house. We're very excited because she's going to be taking us through her perspective, World Cancer Day, through the eyes of a cancer survivor. So I want to say a big welcome to Oluwamayowa Odeniyi. I hope I didn't murder that name. So she's a banking officer at Access Bank, a member of the Living Free Church, and a volunteer leader at the School of Virtue. She was diagnosed of neuroendocrine and pulmonary carcinoid in June 2014. Nice to see you. I hope you're doing great. You want to take us through a brief of your journey and tell us what are your perspective about the World Cancer Day?
Okay, my name is Maya. I've been introduced. Thank you very much. I believe that, okay, firstly, I'll be talking about my experience, my story as a cancer survivor, what I feel the care gap is, and what I would suggest or advocate for. And firstly, I want to advocate that medical practitioners should be trained to care or show care to patients, not when the patient is receiving treatment, but from the first point of contact. What am I saying? I'm saying that most times when a patient comes, walks through your office, most of them do not have a mind, or their mind is not prepared for whatever is coming to them. So, and it's very common for most caregivers to be appointed to patients during treatment and not from the beginning or from the first point of contact. So you walk into a doctor's office, and after, the whole going through your diagnosis, they give you that death proclamation of verdict that you have 2, 3, or 6 months to live. And for me, that verdict will not be able to prepare, that verdict will determine the course of the journey that is ahead for these patients. And most of these patients go back home. Sometimes you find out that some of these patients don't even come back to the hospital. Some of them go, and some of them just feel, oh, okay, I can do it this way, I can do it that way, or I'm going to find an easier route out of it. So I would just want to advocate that medical practitioners should be trained to give care to patients from the first point of contact, and not just when the patient is on treatment. And I would also want to say that sorry, hold on, please. That it is very natural for every human being to get used to a particular norm. But because we know that we deal with lives, I'm talking of medical practitioners, I think we should be more careful in handling peculiar situations as cancer. If you ask any cancer patient, our heartache is that we do not wish this for anyone. I mean, the pain that any cancer patient goes through, you find them saying it consistently, that I don't wish this for my enemy. So that tells you that fight is real, that they're trying to fight for their life. And it's not just about a battle, it's a painful one. But the truth is that, there's victory, at the end of it. I was diagnosed with pulmonary and neuroendocrine cancer in 2014, June 26th. I can't forget the date. And the truth is, I have never looked like it. I mean, if people see me, they are like, "Oh, you don't." But until you go through until I go through a scan or the diagnosis, that is what will interpret the pain that I go through, or that can tell the doctor what is actually happening inside me. So in a nutshell, the cancer experience starts from the moment your life is interrupted, and then you hope that the next doctor's appointment will be the last. Because most times when you're going for a doctor's appointment, you just expect that, okay, the doctor is going to tell you something else and tell you to go and do this, and then he ends there. But you find out that it's always from one scan or x-ray to the other procedure and all that. And the symptoms that nudge. So you are just praying that the symptoms just goes away, the diagnosis, even the stigma. Most people don't want to talk about their experience because of the reaction of the public reaction, or the reaction they even get from family. The first thing you hear is that God forbid. But the thing is that it has happened. You need to find a solution. So a lot of people are stigmatized. They don't even want to talk about this, what they are going through. Some people would definitely want to relate with somebody with like minds, or somebody that is going through, they feel comfortable with somebody who has the same experience. And so they want to quickly, and sometimes the people you meet, if you're not careful, or you don't come to the right people, I mean, to the doctors or to the cancer care or the patient, to the hospital, you might be giving wrong information. You might hear people saying, "Oh, they told me to take these herbs. They told," when I was I remember when I was working at a point, a lot of people were just telling me so many odd things, drinking your urine, telling you to, odd things, medications that you yourself, that these things will not work. But because of the stigma, because of the response or disposition of people to cancer patients, they just feel withdrawn and they want to try and find solutions. And that is why I cannot overemphasize the fact that it is very common that most caregivers are appointed during treatment or post-treatment, which is not bad in itself. I mean, you are needed to give care during treatment, but the mind of every patient that walks through your door is not always prepared for what is coming. I spent 1 year in India, 1 year and 1 week. And if they had told me that I was going to spend 1 year, I would have been discouraged. I would have even said I wasn't going to go ahead. And so once you want to tell your patient that you have few months to live, I think there should be a subtle way of doing it, because it determines the course of the journey from that moment, whether the patient is going to be prepared for the journey ahead, or whether the patient is, within him or herself will say, what, I am tired, I'm not ready to go on. I remember a hospital I went to and I was begging to be treated, and they told me that they were done, that my threshold level, my pain threshold, I've exceeded my pain threshold level. I mean, at that point, I was just like, I told myself I'm going to heaven. So why am I still here? Why should I go through pain? I was ready to, give up. So those kind of treatments or care, it's not really encouraging. So I would also, let me go on by saying that I was misdiagnosed. I heard when Mrs. Tolu was talking about misdiagnosis. It's also something that should be, tackled, because I was actually misdiagnosed in 2008. I started coughing blood in 2006. I started with just coughing of blood, and I felt maybe because it was an asthma symptom, I also assumed that maybe because it was cold, and that was why I was coughing. And I didn't see a doctor until 2008, because I just assumed it was going to go. And it wasn't frequent coughing. It was maybe once in 6 months or thereabout. I think it was just once in that 2006, then 2007. So by 2008, it became very frequent, and I went to the doctor. And I cannot tell you that it was a memorable experience. I mean, the doctor misdiagnosed, told me it was tuberculosis, and even told me that, while I was saying, no, it can't be, she was like, oh. The first thing she said was, you should be happy that it's even tuberculosis and it's not HIV. You can imagine a doctor telling you that. So, and then she started me on TB drugs. I mean, I had no choice. I went with my mom. So, I mean, if I went alone, I would have left. But even with that, I persisted. I started with the TB drugs, but it was oral. I mean, I was peeing blood, a lot of things. I couldn't sleep, palpitating, so many symptoms I can't even put my head to. And now the amazing thing is, or I would expect, because I'm very optimistic, so I would expect that every time I'm going back to her, because she'll tell me in 3 months' time, or every three months, you come back for an X-ray. I would expect that there should be a change. So I do my X-ray. She shows me the mast, like she called it, and she tells me it's reducing, and I don't see any reduction. And she's telling me, just keep at it. Why are you, and her voice is, like assertive. And then I continued. By the 9th month, I couldn't continue. I wasn't seeing any difference in the mass. In the X-ray, she kept showing me that there's a difference. So I stopped going. And you can imagine what happened or what accumulated inside me till 2014. 2014, I met Dr. Ojuozo, a chest specialist, because at that time, I was not just coughing blood every day. I was also tired, falling ill, pain, eye fever, and it was affecting my job. I thought I was going to resign, but I was encouraged by just one colleague. I mean, I couldn't share the story with a lot of people because I was stigmatized. But just one colleague saw the blood and screamed and encouraged me that I needed to go and see a doctor, because I was working and I was being paid to be alive. And I met Dr. Uju also. And one of the things, that she did was to give me hope. In fact, our session was expensive. I want to, at this point, commend Lakeshore for this, and the fact that, when you come to Lakeshore as well, you don't feel off, you don't feel hot. There's always a smile. In fact, every time I come to Lakeshore, I always forget the fact that I'm in the cancer care. What's it called? Center. I do not always feel like I am there. And from the treatment, even to the cleaners, you find them courteous, and the nurses are smiling. Dr. Cynthia, Dr. Uche, who is no more here, and all that. Dr. Oge, Bindia has been helpful. I think I mentioned that I spent 1 year in India. Bindia was very supportive, trying to ensure that I get to India. And okay, so I mentioned Dr. Uju also, and Dr. Uju Ozo's conversation was such that she would deviate the conversation from the diagnosis to my life. She would ask me, what's going on? Are you in a relationship? Tell me about yourself. And for me, sometimes you don't know what you want as a cancer patient, especially when you've been diagnosed. Okay, I think people are asking questions. Sometimes you don't know what's going on. And so then I would always be like, can she just go straight to the point? But she would always divert it. She was giving me hope. She would tell me, don't worry, you'll be fine. It's not an issue and all that. Now, I also remember Dr. Jimo too. Dr. Jimo would say, oh, you've been with us for 2014. The God that did not, the cancer that didn't kill you cannot kill you again. So that care is very important in ensuring that, because it gives hope. You go home, you hear that, oh, you are very strong. If a nurse tells you are doing well, you are very strong. I mean, you look at yourself and say, really strong. Okay, let me get at it. Also, okay, so somebody asked me that, how did she diagnose? Please, I really don't know how she diagnosed.
Hello, Mayowa, sorry to cut in. You have very few, let's say about more to wrap up.
Okay,
and for the questions, we're going to attend to the questions at the end. You can just use your 1 minute to do a proper wrap.
Okay. So like I said, I commend Lakeshore. I've never felt out of place. I've never felt stigmatized. And it's been a comfort zone from the doctors, nurses, and even the cleaners. And also I get a smile every time. Then I also, for my extended family, I care and support. Actually, my aunt, we lost her to colon cancer, and my dad too, but not to cancer. So all hands were on deck. And so I said I traveled to India through the support of my office. Try and rush it now because I actually jotted, but most times you just want to talk about this. So I received support from my office. They paid for all my bills, and I cannot forget that favor. In fact, the head of HR called me and encouraged me to go ahead with the treatment after the surgery. So and telling me that my job will not be taken from me. And spending 1 year and 1 week, one of the things I'll ask myself is that if I had one more day to live, what would I do? They never told me I was going to spend 1 year. They just kept telling me, you're doing well, you're strong, and all that. And for every cycle, once I'm on break, I ask myself, what do I want to do if I had 1 day? So I was making friends. I even had to learn the keyboard, try new things, try the food in India, and, just live. That was just what I was doing. And, I was also thankful for life because two experiences happened in India. I actually thought that if you had money, or I thought money was equivalent to life. But through two experiences, one person, a very young girl, 9 years, she died as a result of no money. And another family or patient-turned family that lost their life despite the money that they had. That got me thinking that it wasn't about the money, it wasn't about anything, it was just mercy, grace, and life. And so these two experiences resonate in me, and every time I'm always grateful for life. I want to round up by saying that the hangouts and the community gathering organized by Lakeshore has been very, very, and I'm always looking forward to it. In fact, I would have loved that they started earlier, maybe when I joined in 2014, Lakeshore in 2014, so that, those times when I was moody, depressed, not wanting to hang out, it would have been an opportunity for me to just loosen up, just like I told Mrs. Tolu. But even with that, it's still how will I put it? It's even with the fact that it's going on right now, like they're still on it. I'm really encouraged by it, and I just want them to keep it up and hope that more awareness will be out there for people who are going through this. They can come together, share their plans, feel at home, feel loved, and feel that this is a family. Thank you, Lakeshore, for this opportunity. I'm really grateful, and I can say Lakeshore is a family. All right, I will end this at this note.
Thank you very much, Mayowa. Yes, you're family to us as well. Very deep and very emotional presentation from you, I must say. I want to also say a very big thank you to you. You're one of the survivors who's always out there, lending out your voice, advocating, and giving people hope, inspiring people out there. So well done to you. Wonderful presentation, and thank you very much. Our next speaker is going to be talking about every day is World Cancer Day. And no one else will be doing justice to this than Dr. Ahmadu Al-Hassan Umar. He is a graduate from University of Maiduguri Medical School. He currently holds a master's degree in health planning and management, also a master's degree in public health, and also a master's degree in international affairs and diplomacy. Dr. Adamu is a cancer eradication advocate who is involved in establishing a nationwide cancer advocacy organization that influences public policy at every level of government and elevates the voices of cancer patients, survivors, and their loved ones. He is currently the president of the Nigeria Cancer Society of Nigeria. Also, he's a member of the governing board, Aminu Kano Hospital, Kano, and the principal medical officer at the Federal Medical Center, Yobe State. Dr. Adamu, you're very much welcome. If you can, please share your slide and you can proceed with your presentation.
All right. Thank you very, very much, Otis, and a very good evening to everyone in the room. I don't know why my camera is misbehaving today. I don't know. Is it blinking on your side?
Yes, it is. Can you share your screen, or you want someone from our end to help you share?
Yeah, I can do that. I can do that. The problem is
Okay.
I don't know what's wrong with the camera. It has been misbehaving since I joined the meeting, so I don't know. Okay. So thank you very much for this opportunity, Lakeshore Cancer Center and Lakeshore Cancer Foundation for organizing this very important webinar session today. And I'm happy with attendance, the number of people in the room, and the quality of the people in the room actually. Because earlier on I was glancing through the list, I saw my very own Dr. Dennis Ejo, all the way from UK, joining us. I saw Lizzie Otaye from Kenya, the East African Health Platform, joining us, and I'm sure there are so many other international attendees at this webinar. So I must appreciate, I must congratulate Lakeshore for in this area of very quality audience. As introduced by Mr. Otis, my name is Dr. Adamu Al-Hassan Umar, of the Nigerian Cancer Society, the umbrella organization for all cancer-related NGOs and individuals in Nigeria, a very veritable partner to Lakeshore Cancer Center, Lakeshore Cancer Foundation. I'm glad to be here today, and I'm happy to be associated with this drive by Lakeshore to address issues that are bedeviling us, to address issues that are bedeviling the cancer advocacy space, issues that are troubling the cancer survivors. It was it was exciting to listen to the cancer survivor that just spoke earlier. Her passion, her belief in positive living, and of course, messages of hope. Her fellow cancer survivors. And these are the kind of individuals we need to be able to, in a way, overcome the obstacles that are there. Dr. Ogie has actually done justice to the topic, close the care gap. So basically, I have a few slides here with me, and I am basically going to highlight what the Nigerian Cancer Society is and what we do, and what we are in trying to close the.
Hello, sir. Sorry, a few people are asking if you could speak a little louder. They can't seem to hear you. Just a
Okay,
bit
can you
louder.
all hear me? I think the computer has some issues. I don't know.
Oh, just
Can you
speak
hear me well?
close. It sounds much better to me now. Thanks.
Looks better now.
Yes.
First camera and then now the audio. So like I said, I am going to briefly talk about the Nigerian Cancer Society and what we do. The Nigerian Cancer Society, as I stated earlier, was established in the year 1968, precisely on the 12th day of October in Ibadan, UCH, University College Hospital, Ibadan, southwestern Nigeria. And it has been serving as the umbrella organization for all cancer-related NGOs. And it has partnership with government, with MDS of government, development partners, civil society organizations, research institutions, the private sector, etc., etc. And it has linkages with, of course, cancer societies across the globe, not only the cancer societies that are working very closely with the Nigerian Cancer Society here in Nigeria. But we engage policymakers, international development partners on policies and programs that will improve access to research, access to cancer care, access to cancer treatment. And of course, we engage in research, we engage in advocacy on cancer. Now, we have a vision, and this vision is a vision that is shared by basically everybody that is working in the Nigerian cancer space. A vision of a nation free of cancer, of course, by implication or by extrapolation, a world free of cancer. Improvement in lives of those affected by cancer. And of course, prevention of the disease. We say prevention is better, cheaper, and safer than cure. Of course, we have a robust system, a robust mechanism of community advocacy, cancer screening and care by network of partners, like Cancer Foundation being one of them, as the speaker, Dr. Ogi, cited what Cancer Foundation has been doing in terms of screening, in terms of survivorship groups, and what have you. Of course, engage community leaders, state and officials to help fight disease called. Nigerian Cancer Society is affiliated to the Union of International Cancer Control and the African Organization for Research and Training in Cancer. UICC, as highlighted in the previous presentations, is the global cancer governing the Union for International Cancer Control. And Nigeria is blessed to have one of our own cancer advocates as a member on the Union for International Cancer Control, in the person of Excellency Dr. Shinkafi Bagudu. Last year, we gave it a shot at becoming the president. Unfortunately, that couldn't happen, but I'm sure it will happen in the very near future. Now, World Cancer Day, as highlighted earlier by Dr. Ogie, was established in the year 2000, and it is held every 4th of February every year, and is the global uniting initiative by the Union for International Cancer Control. This has been highlighted. Of course, the aim is to raise awareness, improve education, and catalyzing personal, collective, and government action towards providing succor to those affected by cancer. When I say those affected by cancer, I'm not only talking about the cancer survivors. Everyone that is close to a cancer survivor is affected by cancer. In fact, the community and the nation at large is affected by cancer. So one cancer case in a particular community affects everyone in that community. Now, the first year, which was 2022, of the Close the Care Gap campaign, is a 3-year campaign, like as was stated by a previous speaker. We started last year, and it was about raising awareness about lack of equity in cancer care and the barriers that exist for many people in accessing services and receiving the care they need. Now, the first year of the Close the Care Gap campaign was all about understanding and recognizing the inequities in cancer care around the globe, for emphasis, because 3-year campaign last year, we understood the problems. This year, we are advocating for resolution or solutions to these problems. It is, or let me say it was, about having an open mind towards addressing the cancer inequities that we have. Now, call for action. If you notice, all the speakers that spoke, including the cancer survivor, talks about collaboration. Collaboration between individuals, collaboration between organizations, collaborations between NGOs, civil society organizations, community-based organizations, etc., etc. Collaboration, and again, collaboration. That is the key, because if we don't compare, there is no way we can properly address the myriad of challenges. There is no way we can appreciate the gaps that are there. If you all remember, for 3 years, culminating in 2021, the theme of World Cancer Day was I am and I will. So it took us 3 years to arm ourselves. I am and I will, taking ownership of the cancer fight, taking ownership of the advocacy fight, to be ready to now address the various inequalities that are there. It's not only in Nigeria, it's not only within Nigerian communities. These inequities, the gaps, cuts across various strata of the human society, cuts across countries, and indeed, even in the most developed world, you still have challenges to assessing care for cancer. In Nigeria, we have been engaging government, we have been engaging policymakers on bringing about changes. First being increase in the budgetary provision for health. What Nigeria has been budgeting is very abysmal. We have been advocating for introduction of human papillomavirus vaccine in the routine immunizations exercise in the country that Nigeria has been making so much noise about. I just came back from a program, the First Ladies Against Cancer, where the executive director of National Primary Healthcare Development Agency also was in attendance. And he said it at that meeting that HPV vaccine will be available this year, will be made to be part of the national routine immunization this year. That was a good statement, because cervical cancer, 100 or 99% eliminatable we can eliminate cervical cancer, and we can meet up with the 2030 deadline of WHO in elimination of cervical cancer only if we have a national rollout, if we have a purposive, decisive methods applied by government in addressing the various inequalities that are there. Another good thing is the new National Health Insurance Authority that made healthcare compulsory for all Nigerians. And again, another 72 million Nigerians are expected to annually benefit from the vulnerable fund that is part of the new National Health Insurance Authority. So we will continue to talk, we will continue to make the noise so that the right thing can be done, providing the right atmosphere for the private sector to flourish, so that there will be state-of-the-art cancer centers everywhere you go in Nigeria, not only restricted to the urban areas, places like Lagos that are very lucky, Abuja and the rest. I want to see a state-of-the-art cancer center like Lakeshore Cancer Center in my village, in Jakusko in Yobe State. Likewise in the state capital. So we will get there. So once again, let me congratulate you for organizing this webinar, and let me equally say that the Nigerian Cancer Society is proud of the giant strides you are making in addressing these cancer gaps that exist. Let me conclude my brief remark by quoting the Chief Executive Officer of the Union for International Cancer Control, Dr. Carrie Adams. This statement Dr. Carrie Adams made last year was contained in one of the presentations that was given by one of the presenters earlier. He said, and I quote, "As individuals, as communities, we can and must come together and break down barriers. We have achieved a lot in the last decade in cancer care and control around the world, but not addressing inequities in society is slowing down the progress. Closing the care gap is about fairness, dignity, and fundamental rights to allow everyone to lead longer lives and in better health." Well, once again, thank you very much. End of quote. Thank you very much for the opportunity to talk at this very important webinar, and be rest assured that the Nigerian Cancer Society will ever be ready and willing to partner in addressing the health inequalities that exist in our environment. Thank you very much.
Thank you very much, Dr. Adamu. Thank you to your group and you as the president of the NCS. We are very, very honored to have you here, and every other person who have taken our time to be here. So very quickly, we're going to introduce Dr. Chumi Wongu. He's coming in next, and he's going to be talking about closing the care gap 2023 and the future. Dr. Chumi is a thoracic surgical oncologist and a cancer epidemiologist. He's a professor of surgery and oncology at the Roswell Park Cancer Institute and at Sunny Buffalo. He's extremely passionate about cancer care in resource-limited environments with a focus on Nigeria. He has been involved in numerous cancer screening missions, awareness campaigns, and professional educational programs all over Nigeria. He's the MDC of Lakeshore Cancer Center. You're very much welcome, Professor Chumi. Over to you. You can have your time with your topic. Thank you.
Thank you very much, everybody. I've listened very attentively to all the speakers, including the cancer survivor that spoke. The passion is palpable. It's just really exciting to be in this forum for us to exchange ideas. I think we've been inspired by what we've heard already from all the various speakers. I will agree with the other speakers that collaboration is key. Nobody can do this alone. As we know, it takes a village to raise a child. And similarly, it takes a lot of people, individuals, corporations, healthcare facilities, advocates, cancer survivors, everybody working together to be able to close the gap, including our government authorities. So I agree completely that is what is needed. We are obviously at an inflection point in our country right now. Everybody's wondering what's going to happen this month. We pray we can come out in better shape on the other side. but it would require all of us continuing to work together. Nobody can do this alone. And that's what we have aimed to put into practice, both at Lakeshore Cancer Center and at the Foundation for Cancer Care. We really believe in this principle, and that's how we intend to move forward. I lot to add to what other speakers shared. I think there's been a wonderful amount of information communicated. I thank the organizers of this forum for all the hard work and effort that has gone into it. And I would encourage us all not to give up. This is a labor of love. And I think as we continue to work together, there is nothing beyond our capability. We can overcome the challenges ahead and be successful. Thank you very much. I'll stop there for now. I like to make my talks surgical, brief and to the point. Thank you so much.
Thank you very much, Dr. Chumi. Very brief and straight to the point. So it's quick question and answer and Q&A session. We have a lot of questions, I don't know. And I'll be running this session with Amanda. And so we're both going to run through questions and be able to see how those questions can be attended to. Also, not in a hurry, don't exit yet, because after this question or during the question and answer session, we're going to put up a poll just for 1 minute, and you're going to fill that pool and give us your own contribution so we can know what we can do better going forward with these webinar sessions. And also, as we proceed, we're going to have a video. I'll let you know more about the video after the question and answer session. We have someone hands raised, Zach Unwe. You want to unmute and probably you have a question you can ask now while Amanda runs through the comment section and see if we have questions there. Thank you very much.
All right, thank you very much. Good day, everybody. Thanks to all the presenters. My name is Zach Onwe. I'm the Health Communications Officer with Talk Health Niger. Yeah, my question, it's really been an interesting conversation with everybody. And the question I want to ask is, I have like 3 questions though, but I think I'll take them one by one. Yes, one of my questions first goes to Lakeshore as a cancer advocacy organization. So the question is, as in 2018, there's the National Cancer Care Plan that was developed by the federal government, which was a 5-year project that ended last year. I think about $250 million was raised or brought together for that particular project. Now, my question is, now the project has ended. How has, let me put it this way, how has these advocacy organizations on cancer or working on cancer, what has been the research? What has been the research on the impact of this particular project by the federal government concerning access to cancer care for Nigerian patients? Right, that's my first question. Then my second question goes to the president of the Cancer Society who just spoke. Now, in 2005, the NHIS was launched. And if you can still recall, as late as 2018, the only percentage of Nigerians that were covered in the in the National Health Insurance Scheme were just 4% of Nigerians, which were basically more of people working for the government, right? So now last year, the NHIA Act was launched and the NHIA, they transformed it from NHIS to NHIA. Now, how are we sure that this, like what you said about 72,000 Nigerians will have access to healthcare through the Vulnerable Persons Fund which is currently on the NHIA. So how are the organizations like your own, working with these organizations to ensure that people living with cancer have access to these funds, right, with NHI or get enrolled in order to make access to healthcare or to cancer care easier? Because from what Olumayowa stated, I can understand that the care for cancer is one of the most expensive aspects of caring for one, right? So those are my two questions, right? So then my last question is, in 2000, okay, sorry, calling it from 2019 to 2020, 2021 or so, about 1 billion has been raised for cancer care, right? About 1 billion, I think, so 7 point something million in 2019, and then in 2020 or so. So about 1 billion has been raised for cancer care. So what has been the rate of access for Nigerian cancer patients as related to this fund, right? How has this funding helped to increase access to care, right, for Nigerian patients with cancer? Thank you.
Thank you very, very much, Mr. Zach. Okay, so over to our speakers. I don't know, we'll start with the very first question. I think the second one was directed to Dr. Adamu. So I don't know who's going to take the very first question.
Okay, I think just to summarize the question, so we know who is to take which. We have the first question, which was directed to Lakeshore Cancer Center and the foundation, and it goes thus: what has been the impact of the federal government's 5-year initiative on cancer access in Nigeria? So this is open to anybody at Lakeshore or at the foundation who is willing to shed more light on this.
Well, I can take a stab at it. Let's see. So from my perspective, as the CEO of Lakeshore Cancer Center and as the chair of the board of the foundation, whatever questions come up about what the government has done and what the effects have been, it's a very difficult for somebody in the private sector to answer. That's the reality of the matter. What resources were really made available to execute that plan? Nigeria never has a lack of really good plans. Even before that, there was a plan in from 2008 to 2013. Now the other plan that came out again in 2018. But it's very difficult for an individual outside of the government to give an accounting for how well a government program has been executed. So I think it's an excellent question, but I don't really think we are in a position to. I think even as the question was being asked, what research has been done on the effectiveness of the program? I must say that I don't have an answer to those questions, and I don't think in our two organizations we can really give a comprehensive answer to that. That is something that the Ministry of Health might be better able to answer. Thank you.
Okay, any other person want to shed light, or Amanda can go to the direct next question to Dr. Adamu? You can go ahead, Amanda, please.
Okay, since we don't have any more comments concerning that, the next question is directed to Dr. Adamu, and it says, how would Nigerians with cancer have access to the available funds in which you talked about?
Sorry, Amanda, Dr. Adamu's not in the call. He's not in the webinar.
Oh my God. Okay,
Okay.
so
You can proceed to the question.
Okay, Dr. Adamu, actually, sorry to interrupt. He had another 5. It's been back to back for him, actually. So he had another webinar starting at 5. So he must have left to quickly join that as well. I mean, anyone in the forum, because we do have quite a few cancer advocates on here, can take that question if anybody wants to contribute their opinion or their comments.
Okay. So in a nutshell, the question just asked the funds available by the federal government for to increase access to cancer care. how does the federal government plan on implementing that within the country? That's just basically the question. So it's open for anyone to, answer it.
I wish I have an answer. Can I just pass a comment very quickly, just like
Sure.
as an
Yes.
advice? I mean, this is for future planning with topics like this, and these are policy related issues. Maybe it would be useful if we're lucky, for the organizers to have, people at policy level, at the national level. It would really be quite useful. Thank you.
Thank you, Mr. Ibrahim, for that comment. It certainly is going to be noted, and in our subsequent webinars, we would make sure that is added. Okay, Mrs. Ifoma Okoye, or Miss Ifoma Okoye, sorry.
Actually, Dr. Ifoma Okoye, I believe, and she's actually in a good position because she is involved in policy around this. So
Great.
that's perfect,
Dr.
actually.
Ifoma Okoye, you can have the floor now.
Okay, good evening, everybody. It's Professor Ifoma Okoye.
Sorry, Professor Okoye. Yes.
Okay.
Apologies.
So thank you very much. It's been quite interesting. Listening, especially the survivor from the bank. I really, really appreciated her viewpoint and have a lot of take homes from there. Now, I would like to feel that I understand the question is targeted to are there any funds that are available to be patients who are indigent provided by the federal government? So if that is what the question is asking, there is a cancer health fund that has been operating in the past 2 years, and 6 centers have been implementing it. And what it is that from the evaluation of the oncologist who is managing the case, he's able to bring out a bill on behalf of the patient, and this bill is passed on to the chief medical director, who approves based on some eligibility criteria, he and his team, and the Ministry of Health team with the oversight managers of the fund would look into it and release the sum. It's called, is it the envelope or the pocket of the patient? Now, it's quite sized it and have had more their treatment. So currently that is what is in place and it is still running. It's called the Cancer Health Fund. There's another.
Okay, thank you very much for that response. I think I should summarize and wrap it up in case it wasn't clear enough, because at some point there was a network glitch. I'm not sure if it's just from my end or it's applicable to everyone. So Professor Ifoma stated that the funds are available and how it's being implemented. There's a process in which it goes through from the hospital level up until the level on the Ministry of Health. And there are criteria where you have to be eligible, you have to meet certain criteria basically to have access to the fund. And at the end of the process, a pocket, a patient pocket is created for the person who probably got access to the fund, and it's useful for their care in general. Okay, we also have Dr. Abby. Her hand is raised, and I think she would like to add a comment to that. Dr. Abby?
Hello, good afternoon, everyone. I'd like to thank the presenters so far, and I'd like to thank the organizer of this webinar. It's been a very, educational forum for me. Yeah, my question is, we have heard about the amount of funding and amount of money put together for cancer care through the federal government and different entity under the government. And I hear all these millions and billions of naira. My point is, who is accountable? Someone has to be accountable, because when you have these kinds of plans and the plan ends, what's the outcome of the plan, and who are the people that are really monitoring what is supposed to be done? Because the problem I have in this space is, we invest all this money. At the end of the day, nobody brings anything back on the table, and we just move on. We've been moving on, and nothing is being done. So if we don't find a way to make people accountable and monitor what people do, we will be here in the next 20 years still saying the same thing, because it's pointless, talking about all this large amount of money and all these figures. But the reality is nothing is happening. And even if something is happening, and I know it is, it's so small, it's not making a significant change. And cancer is not waiting. Cancer is not waiting for anybody or anything. It's happening, and it's increasing all over the world. And the impact is even more in low resource environment like Nigeria. So as we sit here today talking, people are dying. So what do we do now that will reduce that number of people dying? And Nigeria is so large a population compared to other countries in the world. We are going to feel the impact the most. So talking is good, and all of this is good, but we have to start acting. It's getting too late. Our families are dying. That's my comment.
Okay, thank you very much, Dr. Abby, for that comment. I think it's a comment and a question. The question comes in when you ask, how are they being monitoring? How are these funds monitored while they are made available? So I don't know if Professor Ifoma has an answer to that question, if it's available. If not, we have questions from Mr. Ibrahim and Elizabeth as well. So
Ibrahim can go first while we wait for Prof.
Okay.
Okay, great. Okay, go ahead.
Okay. For the Cancer Health Fund, a lot of effort was put in to ensure that there is transparency, and there will be definitely accountability. So the figures are there, and they will be published. The whole essence of having a fund manager was to ensure that this is in place from the beginning. And the effort is such that we believe and trust that when the utilization of the initial fund is published, the details of it will be so well done that other stakeholders, industry, will key in and become part of funding that's cancer on only the federal government, which is being operated. It's quite transparent. I can tell you because I am in Cancer Health Fund Steering Committee at the moment. Thank you.
okay, thank you very much for your response. I hope it's been taken into consideration by the person who asked. Okay, Mr. Ibrahim, you can ask your question or make your comment at this point.
Yeah, thank you very much. I'd like to thank the organizers and all our resource persons. I think I've really enjoyed, every bit of it. In the last couple of comments or questions that have come, we're looking in the direction of policy. Indeed, policies are quite important because really going to shape what the eventual outcome will be. But I just want us to, shift a bit. And my comments relates to the first presenter, wherein she had shared some experience of, if we look, some experience of somebody presenting to a hospital with breast lump and simply was just told flippantly like that, oh yeah, we're going to remove your breasts. And it sounded like she was talking to me. Had a brother whose wife was simply just told that, and of course, no one wants to hear that. So what I'm simply saying here is that for those of us that are medics and are passionate about some of these things and how we come across the ethics of our profession, we need to look inward as healthcare workers, and at every opportunities we've got like this, let's remind ourselves, reach back to maybe it's lack of knowledge, maybe it's lack of, or maybe just complete negligence. And we need to be going to hold, while we're holding policy makers accountable, we also need to begin to hold ourselves as healthcare workers. We need to be able to continue to hold ourselves accountable. Those are just my comments. Thank you.
Okay, thank you very much, Mr. Ibrahim, for that wonderful comment, because it's important that as healthcare workers, we bear that in mind, because as Mayowa stated rightly, the first point of contact is important in the entire care of the patient. Thank you very much. Okay, Dr. Abby has her hand raised again. Dr. Abby?
Oh, sorry, I'm trying to get rid of it. I can't. I'm fine.
Okay.
I'm trying to get rid of it. I'm trying to get rid of it, and I can't. So ignore me, please.
That's okay. While you're doing that, I would just like to respond. I think that was Dr. Ibrahim Yusuf, I believe, that was speaking. I think that's the voice I heard. I'm not sure. Yeah. So, but I think the point he was making about holding ourselves accountable is so critical. The question that we have to figure out is, how do we do this? Cancer care is very specialized. It is not something that, the average practitioner would handle well. And even in cancer centers like ours, we actually have multidisciplinary tumor board conferences where experts come together. We have one of those where people, on a weekly basis, experts in Nigeria, in the US, in the UK, come together, discuss patients. So it's really disappointing for the average doctor out there, whether it's an internist or a surgeon, to just make callous pronunciations on treatment. Given the limited capacity we have in monitoring practice across our huge country, I would say one thing we should continue to emphasize is seek proper opinions. And there's nothing wrong with getting a second opinion, but when it comes to any problem that is specialized, whether it's cancer care, orthopedics, cardiac care, nephrology, really seek out the people that have expertise in the area of interest. So just going to the average person, down the street is fraught with many hazards. So I think it's an ongoing effort, but at least the little we can do is encourage people to get second opinions from reputable institutions. Thank you.
If I may, Prof, just in my singular experience, and I'm sorry if I'm coming back again, I hope I'm permitted, because it's something I'm really, really very passionate about. Indeed, you're right. This is Ibrahim Yusuf. What I did in this specific situation, and look, if I do it, if you do it, if others do it, maybe we may begin to have some impact. So got all my facts together and had to, as a colleague, all right, had to go engage, this provider. And there were two options I had in mind. First, I'm approaching you as a colleague, all right? We all make slips, all right? There's no practice that is 100%, error-proof. I wanted to listen to his side of the story. And if he was to be given another opportunity, what would he have done differently? That was all I was after. And then, well, of course, I also made it clear to myself that, look, if this person is not willing to learn from this, then the next action will come. Because clearly I would have fulfilled number one, all right, our oath. My colleague will be my brother, or will be treated as a brother. But I would not allow another patient to fall victim of this kind of behavior. And so, it may sound insignificant. How many of these are we going to be able to do? But hey, if we don't do it, all right, if Yusuf does one or two, Professor Chumi, when he finds time to come around to do one or two, and we do that before, and then of course we advocate these things when we get to our association meetings. You never can tell how impactful these little efforts will make. Thanks.
Thank you so much.
Thank you very much. Thank you for your comment. We have one more hand raised. Dayo Ajayi Obe. Mr. Dayo.
Dr. Dayo Ajayi Obe.
Okay, sorry. Apologies, Dr. Ajayi.
Can you hear me?
Yes, we can.
Yes, we can. I think last two speakers, the problem is that right from medical school, it's a cultural problem. I think we need to deal with it right from medical school, where we can actually get the young ones knowing how to communicate with patients. I think that's for me is what we need to actually begin to actually train people on communication skills. And these patients are human. Could be cancer, could be heart disease, whatever. But they need to know how to communicate with the patients. Patients are vulnerable. When a person is sick, they take it's several steps before they actually decide to go to the hospital. A hospital is not a normal visit for most patients or for most people. So I think we need to be training younger ones and also our colleagues on knowing how to communicate. It's a discussion. It's not a master servant or top-down thing. It's just you actually have to discuss with the patient, and the patient is joint care. Thank you.
Thank you very much, Dr. Dayo. Thank you for your comment. We have Professor Ifoma again. Professor Ifoma.
Okay, I just felt I needed to contribute to that conversation on how it seems a bit heartless the way some of this news is communicated to the patients and the patient's relations as well. And I've heard quite a number of very horrific, nightmarish stories of reactions of patients' relations and patients themselves to the news. So there's a whole area that is termed breaking the bad news. And there are specialized trainings that are given to equipping people to be proficient in breaking the bad news. I believe that maybe this is a topic that we should actually take up, and this healthcare providers, especially people in the oncology space, so that they will be fully aware. The only problem we have in the country is that a lot of times, this Nigerian Medical Association, the MDC, and for us to bring emphasis to this aspect across board to all medical practitioners in the country. Thank you. I hope you heard me.
Yes, it was breaking at some point, but I think we're able to get bits of what we're trying to pass across. Thank you very much. Thank you. So now I'll just run through the questions and the comments, because we need to wrap up because we've spent a lot of time already. Okay, we have a question from Agbo Elizabeth, and her question is this. She would like to know how to go about her radiotherapy treatment at the National Hospital. She doesn't know how that is done. If anybody has an idea, kindly make a comment concerning that. Secondly, we have a question from Zach. He would like to know what are the criteria to get access to the cancer health funds that are available.
I think we already attended to that, right?
Probably if there's a link to be shared or somebody he can talk to. We have in the chat room. We have Mrs. Elizabeth's hand up, and Ogochukwu as well. So Mrs. Elizabeth, you can.
Yeah, good afternoon.
Good afternoon.
Yeah, good afternoon, everyone. Thanks for having me here. I'm very happy to be here. Actually, I'm a patient, and as well, I'm a medical practitioner. And to be honest, I'm happy for this topic, and I've learned so many things. But my question goes thus. The first thing I wrote it on the chat, and one of the person have addressed me that we should talk later, is concerning the finance. And one thing I would like us to lay emphasis much on, finance, of course, is important in cancer care. And aside that, if there should be an association or organization that can be of help for married couples, especially the females, because being newly diagnosed patient for cancer, it's not an easy journey, and it's not a good news to accept. So there should be an organization that can talk to the husband, family member as well. Finance is important, it's very good, but the emotional part is also very, very necessary and important. And as we know, that is also is another stage of healing process, which can help the patient. Because to me, even though we try to give out billions of naira, and yet the psychological aspect of the patient is not being met, it won't work. And our real focus on helping is not just to give out the money, it's for them to heal, for us to be healed, and for us to have a better life and better future. So if there should be an organization, if there can be an organization in rich hospitals, especially, so a particular doctor that is treating rich patients should know more. And if they can just call up, especially the husbands, because most females are facing divorce because of this illness. And to me, I don't think it's good enough. If we can come up together like this to share an idea and talk, it's for us to have a better treatment and better for it not to reoccur again. So I don't know if you can pull up that, it will be a good one. And likewise, I asked a question concerning my radiotherapy. Not that I don't know how to be about it. I'm presently in National Hospital receiving treatment. So the next stage is the radiotherapy, and I was told it's 18,000. I've never done this before. To me, it's much. I've spent a lot already on this treatment. So I was asking if there's any way they can be of help, because honestly, it's seriously draining me. I don't know what to do. So I don't know if there is a help, because I'm hearing about finance, the government is financing. So I was worried, I was wondering, I never heard of this. So I don't know if I can be a benefit. I don't know if there is any help. So please, I'll be happy if I can partake on this. Thank you.
Thank you very much, Ma. Thank you for your comment. Concerning the finance and the help, I think you should reach out to the foundation. Probably there will be something available for you there as well. So our number will be put in the chat room and our website contact details basically. So you could send us your information and we'll see how we can go about that. Okay. We won't be taking any more questions. So back to you, Otis.
Thank you very much, Amanda. Very well moderated. I know if we continue taking questions, we're definitely not going to be leaving here today. So we'll encourage you to send your questions. They're going to drop an email in the chat box. Send us your questions. We're going to direct all your questions to to whosoever it's going to be responding. I will pass back the feedback to you personally. So before we round up, I want to also make you understand that we're going to be playing a video, and it's more of our activity for the last World Cancer Day. And we're going to use that video to exit, but I want us to actually take our time to watch that video to the very end and see how we did a very wonderful collaboration with other corporate society organizations and all. But before we watch that video, I want to take our time to say thank you to everyone who has participated for this webinar. Our vast and knowledgeable speakers, our very Oge, Tolu, Professor Chumi. Big thank you to our survivor, Mayuwa, for coming all the way out, putting your voice out there to be heard. You're passionately advocating for cancer, and we are really glad to have you here. We say well done to you. Also, we want to give our immense gratitude to Dr. Adamu for making time out for this, in spite of his very busy and tight schedule. We're also very grateful to everyone that's present here, and also those behind the scene who work tirelessly to make this successful. Monisha, Bindia, my humble self, and also Amanda. Most importantly, we say thank you to everyone who has joined us today, making our time to be here today. We say big thank you to you all. We can't forget to say thank you to SynLab for never failing to give us the CPD points met for all the attendees. We really hope that we continue to work hand in hand in achieving the ultimate goal for cancer prevention and eradication. So feel free to contact us on any topic you feel that it's worth discussing. And while we are still on it, I would like to share a video that had quite a number of organizations that collaborated and sponsored, like Cancer Aware, Century Foundation, SynLab, ISOH Foundation. So we had a lot of corporate sponsors like Leadway, Fidelity Bank, Providus, First Bank, Medco. The list is just endless. So I'm going to be playing this now, and I want to urge every one of us to take our time and just watch this video. Thank you very much.
Cancer is not a death sentence. The thing is awareness. We had a lovely time with her. Prevention is better than cure, and we all know that. So how can we prevent cancer? Well, there's some things that we can't do. There's some risk factors that we can't avoid, like age, or if you have a family history of cancer. But actually, our lifestyle has a huge impact on whether or not we develop cancer. In fact, it's been shown that if you have a healthy diet, that actually reduces the risk of 20 cancers. So if we want to say, how do we fight cancer? First of all, we should be aware of it. Second of all, we should improve our lifestyles in terms of living more healthily. Third of all, we should get screened so that if there is a chance we can get cancer, then we catch it early. And fourth, we should seek treatment sooner rather than later. And that is how we'll be able to bridge the gap and beat cancer. Thank you very much.
My name is Mrs. Ifezubike. I had my breast cancer was diagnosed in 2017, 5 years ago. So I went through surgery, I went through chemotherapy, and I had it at age. So I'm here to testify that cancer is not a death sentence.
I lost my father and my uncle to cancer. So today you're dancing for those we've lost to cancer, and we're dancing for those who have survived cancer.
That's been from cancer, no, apart from the person that gave a testimony.
I have members of my family, sorry, who have had cancer. Yes.
Have they been cured from cancer?
Yeah, they're in remission. Going about, my dad is one, prostate cancer.
Everybody, please be seated comfortably. Thank you very much. We're not try. Now part one we just do now. Part two won't start soon. Guys, you don't say you're enjoying the work. Let me see your hands for up. You're enjoying the work. We have emergency CPR training here today. Please trust me, it is very important.
Right here we'll be doing a demonstration and a quick one on how you can do and also choke management. We have cases where people, even from eating, will get choked.
So we'd like to say thank you for giving up your Saturday. I know it's not easy. Most of us work Monday to Friday, and then you are here very early on Saturday to this time. We really, really appreciate that. Thank you so much. And of course, to all our sponsors and partners, we have Providence Bank, Leadway Assurance, First Bank, JNCI, and Fidelity Bank. Thank you so much for your support. We appreciate you. And of course, our partners. First of all, the director of the fire service. Thank you so much. We got this place for free without paying anything. And then the Nigerian police force and the police college as well. We really appreciate you. SynLab. We thank WFM, our media partners. Thank you so much. Doctors on Air, EDC, and of course, Lakeshore Cancer Center, our major partners. Thank you. Then we also thank Centurial Foundation, Cancer Aware, NESI, ISOH, Shift Alice, our lovely gym instructor. We had a lovely time with her. Lafitte Jim, also Emergency Response Africa, that just showed us, how to carry out CPR. Of course, Mr. Biodun Maduka, our videographer. Thank you so much, sir. And then our Board of Trustees, their support was greatly immense. We are really appreciative of them. And finally, Dewdrops Cancer Support Group. Thank you to everyone for making this a success. We appreciate you all. So we wish you a lovely weekend. Thank you. Bye.
Thank you very much, everyone. We want to say it's a wrap from here. I wish every one of you a great time as we reflect on this, the theme for this World Cancer Day, and we'll keep pushing on to close the care gap. Do have a wonderful evening and have a great time. Take care of yourself. Thank you.